This mobile magazine application acknowledges the important role that peers and social media can play in the lives of our adolescents. Ultimately, this magazine seeks to engage with this group in a way that is interesting, as mentioned by His Excellency, the German Ambassador, fun and meaningful to them, and deals with love, relationships, lifestyle, general well-being, and their health. It integrates important HIV and prevention messaging within the context of their lives, supporting positive decisions and positive behavior change.
Young women in particular are bearing the brunt of these burdens. And we see this reflected in some pretty tough stats, including the prevalence of HIV and the rise in numbers in teenage pregnancy. And I know that you all spoke so eloquently, but maybe I'll just reiterate. Teenage pregnancy is one of the leading causes why young girls drop out of school. 70% of pregnant teenagers drop out due to being pregnant. In 2012, Johannesburg alone had 5,000 schoolgirls who fell pregnant. Young people are also not using condoms in comparison as much as they used to. In the age bracket of 15 to 24 or 25, only 67.4% of young men use condoms in comparison to 85.2% in 2008, and only 51% of young women in comparison to 66.5% in 2008. We still have a lot of work to do. HIV infection among young women between the ages of 15 and 24 are more than 3 times higher than boys in that same age bracket. These numbers are unacceptable. And it's so unnecessary because they are preventable. The great news is that South Africans know how to take control and create change for the better. These stats do not have to be the fate of our youth. We do not have to be the country who is known as the epicenter of this disease. We can change this. Change is possible, and I have seen it. I see it with HIVSA and the Africa Outreach Project when we connected with HIVS last year and saw what you guys were doing. You were so inspired and wanted to do anything that we could to support you and to be a part of your program. Which is why we're here tonight.
We have to know that what we are doing is resulting in positive behavior change. We need to know that we are having an impact on their health and much broader on their lives in general. I think monitoring and evaluation and monitoring impact across all programs, not only this initiative, definitely is the way to go for us in the future. These young women need to become the new role models for the next generation. And that happens a lot sooner than what we think. So we are asking you tonight to believe in us, to believe in the youth of our country.
And now's the time to push even harder and to support innovative programs and efforts. Honored guests, ladies and gentlemen, it gives me great pleasure to launch such an initiative. This mobile magazine, under the branding name of Choma, will provide an entry point into meaningful engagement with young girls and young women. Yes, let's hear it. Impacting on them as young, vibrant individuals, while at the same time ensuring that if they are HIV negative, they stay HIV negative for the rest of their life. And if they are positive, they know how to access treatment, care, and support. Thank you all for coming tonight. It means so much to me. I know it means so much to all of us up here in celebrating the launch of this amazing project with us. Thank you.